Hello everyone, this is Daniel here again with another update for the organ donation process for the living organ donor. I was down in Toronto again just today. I had another series of tests which included redoing all of the blood work. It included chest x-ray, urine sample, and a new machine called a FibroScan that they had there. The testing was quite quick. All in all, I think we were only there for a few hours. I met with the social worker, met with the doctor in charge of the program, and just discussed it. And at the end of the day, I found out that there has been a match found for me, and that the surgery is booked for the 28th of this month. So that's the 28th of May, 2 weeks from today. So it's very interesting how it all worked out, but it's nice. I'm glad that it's that we found a donor, and that the process will be going forward with the surgery. It was a very interesting trip. We had to drive down there early in the morning, so we left at 4:45 in the morning to be down there in time for the first appointments and the testing. Toronto traffic, as always, is lots of fun. But it was a good trip, no incidents, and the trip did go very smoothly. Alright, so some of the specifics of the FibroScan, which was a new test for me. Basically, it's a tall machine that's portable, looks to be on wheels, and it sends it kind of actually looks like an ultrasound machine, like the wand looks like an ultrasound wand, except they don't use like a goo or a gel. They put it on the side of your ribs, and it sends an electrical current, kind of like a sound wave maybe, through your body, and it allows the machine to read different things like liver rigidity or liver stiffness, sort of fat content, how your liver is made up, in a way that gives them information so that they wouldn't need to do a liver biopsy. So that was an interesting machine. It was very quick. Being kind of a sort of a sciencey nerd, I really enjoyed hearing about how the machine worked and what it was doing, what it was looking for. That test was very quick. Went over some more paperwork again, just sort of working at the final stuff, saying, do I want to go ahead with it? Yes, I do. Things of that nature. So between now and the surgery date on the 28th, I have to speak with my employer, talk to the insurance company about sort of like sick leave benefits through work to see if it's covered, work out places to stay when I'm down there before and after the surgery happens. It's just sort of, I have 2 weeks to essentially get my life in order for the next 3 months potentially of the recovery period, which is a lot in 2 weeks, but I've been expecting it for the last year, so this is something that will go fairly smoothly, I think. The blood work entailed, I think it was 15 little vials of blood. It appeared to be sort of like just a battery of tests for everything from syphilis to HIV to different things on the screen which I didn't understand. But it was a good chunk of a good quantity of blood, so that was interesting. I'm used to needles, but for some people who don't like needles, that would be probably 5 minutes of looking away. The nurse who was drawing the blood, asking me if I had eaten anything in the morning, if I'd been fasting, telling me that I should get something sweet like orange juice or apple juice or something after the blood was drawn. That was immediately followed by the urine test and the ECG, which was very quick. After I was done in that area for the testing, I went over to the X-ray department to get the chest X-ray done, which was literally done in less than 5 minutes. I was in and out, which was very, very fast. On our way down, the one sort of hiccup we had traveling to Toronto this time was we were going to park at Yorkdale and take the subway down to University. And normally we would park sort of in underground parking, or the parking lot that was there. When we got there, it was under construction, and we weren't able to park there. And not being familiar with Toronto, we had to drive, just sort of randomly picked a street to go down because we didn't know where we were supposed to go to park. We ended up back on the 401, which took us over to Yonge and then to York Mills, it did end up working out. I mean, the subway ride was a lot longer, but it was just kind of one of those nerve-wracking moments and where, we had no idea where we were going or where to park. And so we just we crossed our fingers, picked a direction, and it ended up being the correct direction. I have to say a special thank you to my beautiful, wonderful, gorgeous girlfriend, Amy Wallace, for helping me to get around down there, for driving me down. For everybody who's driven me down. My sister drove me down for my other appointments, and without the help and support of the people around me, it'd be very difficult for me, being that I don't drive a car myself, to get to and from these appointments. So it means a lot, and to have somebody there means a lot as well. I know today it takes a lot of the stress out of the trip if you have another person there, especially somebody that you care about who's able to share that experience with you. It definitely makes it a lot easier. There's a lot de-stressing, and you kind of almost share the stress of the trip between the two people. And it's an experience that you get to share, and then later down the road, remember. And so I'm very, very happy to have been able to have Amy with me today. It was a good day. It was a long day, a lot of driving and a lot of testing and talking. But it was a good day. When I was at the hospital, I asked the doctors when I was there if I could film inside the hospital after I come out of the operating room. And basically what they told me was that so long as I didn't have any of the other patients or any of the staff in the frame, that I would be able to film, what I'm going to look like when I come out of the recovery room. So basically, I just have to let them know ahead of time that I'm going to be filming, so they're not wondering what's going on, or that somebody else is going to be filming me when I come out, and that just being sure not to get anybody else in the shot. So I will be posting, or somebody will be posting, a vlog about my first moments out of the surgery and what I'm going to look like and how groggy I'll be. I won't remember it at all, and I'll probably look like death warmed over, but I'd want everybody to be able to see sort of, what you're actually going through for that, and what your family is going to see if you decide to donate, what they're going to see when they walk into the step-down unit or the recovery room, because it's probably quite a shock. I won't know until I'm out of the hospital and I get to see the video myself, but it's nice to know that I'll be able to share that with you, just to give you a better idea of what you're going to look like after the procedure is done. I'll also try and get a sort of like a pre-operative video out